So I am absolutely thrilled to welcome on to this special Science of Rowing podcast roundtable. I have joining me Brannon Johnson, Sara Lombardi, and Dr. Kathryn Ackerman. And this afternoon, we're going to be discussing pregnancy throughout rowing, or rather rowing throughout pregnancy, and the challenges that women may face leading up to and during each trimester, as well as some strategies that they can hopefully implement. So thank you all for being here this afternoon. I'm really looking forward to speaking with all of you. So why don't we quickly kind of go around the round table and everybody take an opportunity to introduce themselves, provide some of your expertise, your background, and what you're hoping to look to learn today and share with the group. So Brandon, why don't we get started with you?
Sure. My name is Brannon Johnson. I'm the owner operator of BLJ Community Rowing. Wow, I've been rowing for a very long time, so we're not going to go into that. I am getting old, but started the first African-American owned and operated rowing organization in the country, which I did not know I did. So I think that's even funnier, the irony there. But we're getting just a lot of the country's kind of looking to us, and US Rowing's been kind of looking to us for how we can help diversify the sport. And I really was interested in this because I have had, out of my 70 masters, I've had about 5 pregnant women. And so we've seen kind of the growth and how this happens. And I've definitely had to alter my coaching and switch their workouts. And so, yeah, there wasn't a ton of information. So I kind of had to sort of engineer solutions in real time. And, you know, I think every pregnant woman that we had is still wrong with us. So I consider that a win.
That's fantastic. Awesome. Thank you so much. Sara?
Sure. So I'm Sara Hendershot, and I found rowing in high school. I took it through college. I ended up rowing at Princeton University. Princeton shares a boathouse with the national team. So I was exposed to what that looked like while I was in college and kind of got sucked in and ended up graduating and throwing my hand at trying to make the Olympic team. Ended up making the London team in 2012 in the women's pair. Finished in 4th by like a hair, barely missed out on a medal, which kind of made me come back for another round of trying to train and see if I could take it a little bit further. So I trained all the way up through Rio selection before I retired. So I guess that means that now I'm retired for about 5 years from the sport of rowing. Since then, I've built a career in brand marketing and sports marketing, and I live in Cambridge, Massachusetts, so right in the center of rowing world over there. And I'm actually now 7 months postpartum, so just had my first kid, and was approaching pregnancy, really unsure of what to expect in terms of how to approach that as a former professional athlete and somebody who really valued, my body's performance. And that was a huge part of, who I was for so many years. So not only was it kind of this like identity shift of figuring out how to handle pregnancy from this mental standpoint, but then also like, how was I going to continue to feel like I could invest in myself physically and do it safely and set myself up for a healthy delivery and then a healthy postpartum period. So I did a lot of my own research, which Joe talked about a little bit. And then I think experimented on myself as much as I felt willing to and did a lot off of feel too. So excited to kind of share that experience.
Thank you very much. Dr. Ackerman?
So I'm Kate Ackerman, and I picked up rowing when I was in college. I walked on to the team at Cornell and wasn't very good and sort of figured it out and got better as I went and had an appetite for more when I graduated. And so also was on the smaller side. So it was one of the smallest or the smallest in our varsity. And I thought maybe if I just lost a little this freshman 15, I'd actually be a decent lightweight. So I became a lightweight rower and was on the national team as a lightweight rower. And then I also was pursuing medical school. So was actually on the team while I was in med school and got very inspired by our team physician, who at the time was Joe Hannafin, who is our most recently the head doctor for US Rowing. I just took over her position as the chair of our US Rowing Medical Commission. So I've been involved in US Rowing from being an athlete to being involved in the medical committee and now chairing the medical committee. So that's a dream come true in the last couple of weeks. I decided to take my career and really kind of tie my passion with rowing into medicine. And so I'm an internist, a sports medicine doctor, and an endocrinologist. And I run our female athlete program at Boston Children's. And I think the question about exercise and pregnancy is a really important one that's been missed for a while. I have 3 kids, and certainly the mindset of an athlete and wanting to be athletic, whether you're still training or you're just trying to stay fit through your life, pregnancy can be a little bit daunting. And so I had 3 very different experiences with all 3 of my pregnancies because of the pregnancies, and we can talk about that a little bit. But I think my biggest issue is we need more research in this, and we also need a little bit more grace for our females trying to do this, because you can have the best laid plan and things can come up, or you might have to shift your mindset. And I can promise you that you can get back to doing great stuff. One of my pregnancies, I wasn't allowed to exercise for most of the pregnancy because of placenta previa, which sort of devastated me because I totally had a plan after my first pregnancy. I got to exercise till the day I gave birth. So sometimes we just have to shift the mindset because things happen, but there's a way to do it. And I think now with so many of our elite athletes really showing what can be done, it's really inspiring to push the limits, to see these Olympians who are competing as pregnant athletes and seeing people training for the Olympics and coming back to it really fast. So I'm excited to join in on this conversation.
Fantastic. Well, thank you all. That was great. So I think before we launch the discussion, I mentioned this off air, but my whole goal with this podcast and this journal that I reviewed is to really get this discussion going and start having more of this information out there, because I do think, as Dr. Ackerman just touched upon, there's not a lot of resources currently available. And I think that's an area that we can really improve upon. And I think this is just getting the conversation going. So I'm really looking forward to learning from each of you, as well as, I think hopefully we can put some strategies out there, and anybody that listens to this, they can walk away with some potential options that they can integrate into their own life and training. So briefly, I'll just kind of summarize a couple key points from this study. So it was a qualitative study done in 2017. It was published, and so this was focused on 224 female rowers, and some of the key takeaways. Not surprising, as a athletic population, above average physical activity during the entire term of pregnancy when compared to other pregnant women in their age groups. There was some noted challenges experienced in terms of athletic identity. So when we say that, for example, concern with potentially not meeting their expectations internally or expectations of their teammates. And then also, as we're undergoing or a lady's undergoing these changes throughout the term of pregnancy, the kind of realization that they may not be able to keep up with their previous ability levels in terms of pace or physical output. So the challenges surrounding that. And then we have some of the safety concerns that are in some ways pretty unique to rowing, with the erg handle or the oar handle. Is that a potential safety risk in terms of abdominal trauma? And then, when I was doing some of the research, there aren't any clear guidelines in place for our sport. So those were some of the key takeaways from the journal. But for myself, I'm really looking forward to learning more about this and getting, perspective from each of you. So Kate, I would actually kind of want to kick this right back over to you. And you had mentioned that all 3 of your pregnancies were different. And so for me, when I was doing this was a very humbling experience, because there's a lot of terminology and things that I had no idea. So this was a complete learning experience for me. So I think this conversation can also be really useful for coaches. So my first question is, and I'm probably going to mispronounce this, what I think you said is Placenta Previa. Yeah. So she's laughing. Yeah.
Placenta previa. So
Yeah.
it's
Placenta Previa.
the placenta of the baby is lying a bit low and it's over the cervix. And so there's this concern that you can get vaginal bleeding and you could get a miscarriage because the placenta is not completely implanted 100% at the uterus, but it's a portion of it is over the cervix. So that can show up on an ultrasound. It can present with some vaginal bleeding. It can seem really scary when you're pregnant and you're early in your pregnancy. And, you know, there's a certain time during pregnancy where if something were to go wrong, it would definitely be a non-viable pregnancy if the baby needs to be delivered early. So it can be a scary thing for women. So if something like that comes up, that's just an absolute contraindication for being able to do a lot of this kind of exercise. And this is why a lot of women need to go on bed rest. So I think for all of these conversations, we always have to keep in mind, you can have the best intentions, but if there's certain medical issues that come up, uncontrolled medical problems, placenta previa, preeclampsia, if you have an incompetent cervix, all of those things are real medical indications that you have to have the baby be the priority and the exercise can wait a little bit. But as somebody who had 3 different full-term pregnancies, I can say that I was able to exercise a ton in one of them. I was not able to exercise much in that one. And then I was able to exercise as much as I felt in the third. And all my kids turned out great. And I was able to get back into shape after all 3 of them. I gained more with the one that I, couldn't exercise as much, probably because I was sitting around and eating more. But all of these things are reversible because this is a finite amount of time that you're not doing what you want to do, but you can overcome it. I was very fortunate that I could bounce back from my pregnancies really quickly and exercise again. And I actually had C-sections because my body doesn't like to go into labor. So, that was something where OBGYNs are always hoping you don't need a C-section. Certainly I didn't have a planned C-section with my first one, but I was 2 weeks post due date and my kid wouldn't come out. They were trying to induce me. Joe's eyes are popping out right now. So you could have the best plan, best laid plan. There's like a birth plan on my wall. In the hospital, I just wrote, get the kid out. Like, I don't care what you need to do, whatever you guys want to do is cool. Just get the kid out and then we're good. So I think you just have to be flexible and realize we're really lucky to have modern medicine to help us when it's not perfect. Yes, it would have been wonderful to deliver a baby in a tub and have it come out in the full sack and have this joyous experience, but mine were different and I was able to bounce back pretty well. So I think I was lucky.
Well, Sara, did you want to kind of share about your recent experience, and Brannon, you could talk about maybe some of the athletes that you've been coaching that have gone through their pregnancies recently?
Sure. I mean, I guess just to kind of add on to what Kate was just talking about, right? So I also had a couple complications with my pregnancy, and that in and of itself, I feel like was something kind of surprising to me and something that I had to wrap my head around. Like, I'm this super healthy elite athlete, right? And I have a couple of complications with my pregnancy. And so mine were that I had a marginal cord insertion, which means that your umbilical cord attaches to the side of the placenta. And then also I had a 2-valve umbilical cord, which essentially means most umbilical cords have 3 valves. So there's like 2 that send nutrients in and 1 that sends waste out. And mine only had 1 in, 1 out. And so they're kind of rare cases, both of those, and not like huge deals necessarily, but the biggest things that sometimes happen are that the babies are born with like heart issues or have a really hard time growing because there's just not enough nutrients actually making it in there. So my doctors were like, hey, you're really into exercise, and now you have a little bit of these complications. Like, this could be a recipe for disaster if you are training too hard and like not allowing your baby to grow. So that kind of like right from the bat, I was like, all right, I have to really prioritize this kid, right? Like I'm going to sit second here. And even just shifting that mindset was a big deal, right? To be like, I have been first on my list for a very long time, and I am now going to be second. So I think that's something that isn't talked about that much with athletes or rowers, right? Just how to approach that mindset shift and understanding that it's not necessarily going to happen immediately or super easily, and that you may have to like work through that process. And that was sort of my experience. But then from there, I really wanted to approach all of my training from like a perceived effort standpoint, right? Because I felt like I was so good at being in tune with what my body could handle, that was going to be the best barometer for me. And so taking away the idea of PRs and taking away the idea of weights or times and just going on how I felt. And so that for me meant that actually I had some unexpected like highs and lows throughout the pregnancy. I was incredibly nauseous and really tired in my first trimester. And I felt like I lost all of my aerobic capacity. I was just like unable to breathe. And so when I think about these Olympians who actually compete in their first trimester, I'm like, that is incredible. I could never have done that. Like my body wasn't going to let that happen. And then second trimester, I felt amazing, just like so good. I could do anything. And I actually was lifting a ton and felt strong and great. And like everything was tracking awesomely with my pregnancy. And then I got huge in my third trimester. So I was just very uncomfortable. And so working around my size ended up being one of the biggest things I had to be conscious of. I was also third trimester in the summer during a pandemic where I was wearing a mask all the time. So it was really hard to stay hydrated. So it became like really important for me then to minimize the amount of training I was doing and be conscious of just like making sure I was hydrated and fueled and resting enough and all of that. But I did almost all of it off of perceived effort. And I mean, I sent you a video, Joe, yesterday of me like doing overhead squats at 35 weeks pregnant, like looking great and hitting a great amount of weight. And like, that was just because it felt good that day. Right. And if I didn't feel good that day, I was going to back off. So, I mean, I could go into any of that deeper, but I would also love to hear from Brannon around her athletes too.
Yeah, so it's interesting. I think, for me, it's adjusting my athletes' expectations, I think is always the first thing. I come from a really long rowing background. So I rowed all the way through high school, college, I was UT, and then started training. So understanding like the psyche behind it. And for me, it was definitely whenever one of my athletes comes and tells me they're pregnant, my first thing is they have to adjust their expectations. And I think that's difficult because you have to, it's mindset and it's being flexible. So, and then you have this whole other thing that's called like the team and whatever boat they're in. And the hardest part is, one of my masters is very, very fit. And it's funny because we actually, we are the same age. And, she strokes our very, very fast quad and I didn't take her out of the lineup, but I did talk to her boat mates, and we did have to come up with a plan that everybody felt good about. And I think that's it. They train 3 times a week. So as she got bigger and as she progressed, we just let up. We just stepped off the gas, and she felt so much better being able to get in a boat once a week with her squad. And they were training 2 other times without her, and I would put a sub in, but just the fact that she didn't lose that connection. And she bounced back, and she's already back, and she's killing it. But I think, over the years, the one thing is adjusting everyone's expectations. And each mom is very different. And that's hard because they don't know, they have their own fears, they have their own things they're scared about. And then this thing that they have is something they're going to lose too. So I think as a coach, as long as I am being clear in my communication and letting them know they're not going to lose us and they're not going to lose that connection, we've definitely gotten better at communicating that to everyone. I'm going to say the single is your friend. I definitely, once you hit that second trimester, you're coming out of any kind of group boat. Like you're going to go on a single. That way we can adjust practice to whatever you need. And one of my moms was very, very nauseous, like threw up all the time, and we could stop whenever she needed to, or you know what I mean? And that's another thing. Another interesting thing is the dynamic of getting in and out of the boat. It is demeaning whenever your belly's in the way and you have to have your coach assist you in a boat, which is why the single is good, because no one else is on the dock with them. So I kind of set their practices in the middle of the day, or I work the schedule so that they're usually by themselves. So no one has to see them, like not really you gotta just figure it out. You know what I mean? It takes some time. And I think the third point I would make is your body's gonna tell you what you need. And I think rowing is such an elite sport, and it's brutal, right? You gotta go. You're 2K. You're always pushing. You're always driving, and I think we sometimes miss that. We're always telling our bodies to do more. We're always asking more from our bodies. And once you get pregnant, that's the time that your body dictates what you're doing. And rowers have no concept of this. So I spend more time snatching oars and snatching equipment and telling them you can't carry that and you can't do this and you can't do that than anything else. So yeah, I would say those are probably my three things.
Brannon, when do you try to start having that conversation with some of your athletes that are beginning pregnancy, like as soon as possible?
So our first pregnancy went horribly wrong. We let her row. She rowed almost to her due date, but she flipped in October in Philadelphia. And I had a panic attack. I literally, and my assistant coach, Marcus, was out. She was in a single. She was out with Marcus, my assistant coach. They came back in and she was more worried about me killing my assistant coach than she was about her child. And she's like, it's okay. We're okay. I was like, what happened? October. Philly's cold in October. And the baby's fine. She's fine, but she was my first pregnancy. Her name's Carrie, and she's got 2 kids. And I think we figured out a lot of what not to do. I had to build a community where people felt comfortable coming to tell me. So once Carrie had her baby, the next person who was there when she saw me freak out, she didn't want to tell me that she was pregnant because she knew I would pull her. She thought that I was going to pull her and thought that I was going to do all these things. So by the time we got to the 3rd pregnancy, we kind of got it. So they feel comfortable coming to tell me. And I think as soon as they come and tell me, I set up an immediate one-on-one where we talk about what they're scared of. Because fear is probably the biggest thing. And if I can figure out, I like to have a one-on-one conversation to figure out what their fears are. And then we try to come up with a plan. Now, as soon as we come up with what a plan is, I also say we have to be willing to make adjustments because this could go to hell. Sorry, this is a recording. Sorry about that. But you know what I mean? I think it's important to, especially women, and being a woman coach. And the interesting thing is it's a very interesting sort of conversation because I'm not a man. So, I am the head coach and we get to sit down. I don't have kids, but, there's a comfortability and we kind of sit down and we kind of figure it out. So they come and tell me as soon as they find out. Now they're coming and telling me, and we're sitting down and they've seen enough of it to know we can build something that's going to be fun, that's going to keep them engaged, keep them moving. And that's the main thing, is keep them moving, it's not about splits. It's not about time. It's about getting out, getting some sun, getting in a boat, being fluid, getting your body moving. And it's about time. You know what I mean? And I think, once I was able to understand how the body sort of moves, and I can shift the practices. So you're getting your cardio workout, but you're rowing on almost a paddle. You can put in some miles and you have that launch right there. And you know what I mean? And you get off and you're feeling great. And you know what I mean? I think that's kind of what I want you to keep feeling great. I want the baby to be growing. I want you to not lose connection with your team. I want you to not lose something that's important to you. And, we figure it out together.
I was really lucky that I was already rowing with a group of women who are like my sisters, and we row something called the Mommy Quad. And so, of the four of us, we have 10 kids, and I was the last one to have the kids. So, I had these three awesome women kind of giving me their experiences, and they're like, finally, Ackerman's having some kids. All right, this is how it's going to happen. And so, we would row every single week on Friday together. We would do our weight workouts on Saturday, and I'd gotten to see how they went through pregnancies, and they now were like mama bears to me, to just reassure me, oh yeah, you're going to feel like this and you're going to feel exhausted, and don't worry if you feel nauseated, this can kind of help, and if you have to bag this, that's fine. And so I saw them go through that and bounce back, so I felt really good having that sisterhood to kind of help guide me when I went through my pregnancies. One of us had, two of us had babies within a week of each other, and it was fun because we had completely different pregnancies. We weren't always able to do the exact same workouts, but we stayed connected through that whole experience and got to be at the boathouse together or in a boat together throughout that. So I think it's kind of like how women join different mom groups. For me, I didn't have a bunch of mom groups because I had my rowing mom group, and that was all I needed. That was super helpful to me because they already were living the lifestyle I was familiar with, and they'd been through this process.
Joe, I just would want to respond maybe to what Kate and Brandon were saying, which is like really cool to hear both of those anecdotes. And Brandon, especially like the community that you're creating for women, right, is so exciting to hear that, because I think you're like, you touched on this duality, right? The two sides of like needing to empower the women to feel like they can actually continue to feel like themselves and do things that don't include, you know, completely being like a bed rest woman that can't do anything for 9 to 10 months, right? Like that to me, I really was opposed to that of like, hey, I'm still myself. I'm still the same person. And I know that like I can do these things, right? So to be able to give a community where you're empowering women to do that, but then also putting in place just some like stops, right? And what you're describing as well, Kate, is like the experience of your friends to be able to say like, hey, you might not be able to do all these things. So like helping the women kind of live between these two, like, no, keep doing things that make you feel like you, because that's so important. But then also recognize that it's okay to pull back and to need some help throughout this process, right? That's exciting to hear, because I think that is just such an important part of pregnancy and then postpartum as well, as being able to stay connected to things that actually allow you to feel like yourself and that like give you that community.
Yeah, absolutely. I think one of the common threads that I'm hearing from all three of you is that you need to be adaptable and be okay with changing what you need to do. You know, it's okay to have a plan, but you might have to, you know, pull an audible. And then the other thing is that, you know, pregnancy is completely unpredictable. And so if multiple pregnancies, each one was different for you, Kate. Brandon, you were talking about some of the athletes you've coached, how each of those athletes had a very different experience. You know, so for me as a coach, and just listening and sitting back and hearing all of this, you know, I think it's just understanding and appreciating that, you know, you need to be patient and listen and supportive. And it's okay to have a plan, but it's also okay to, you know, just completely, you know, take it up, ball it into a little ball and throw it in the trash, because you might not be able to adhere to that. And one other thing that I from my perspective that's kind of interesting is a lot of the research of the journals that I read in preparation for today talked about, well, you know, in the first trimester, you can really maintain a normal routine. But some of the things that I'm hearing from you all kind of lead me to believe that, well, yeah, that might be for this person, but it can also be, you know, where you experience a lot of being nauseous, having difficulty breathing. So it's completely unpredictable and unique to each person. Yeah, go ahead, Brandon.
Yeah, I just have one thing about that is, so two of my moms rode with we had a woman that was going through chemo, and I put them all in a quad together because they were all nauseous. And the bond that they still rode together. they still hang out together, and it's amazing. And two of them don't even live in Philly anymore; they've moved. But it's think outside the box as well. I think there were parts of our community that supported other parts of our community. So we had this woman going through chemo treatments and this new mom, and they both needed the same sort of practice. You know what I mean? So like as a coach, just I couldn't have created a better environment, but because I was just listening and like paying attention, I mean, it's just really amazing. But yeah, like there's some similarities with like chemo. You know what I mean? Like it's very similar that first trimester, and it all lined up perfectly. And it wasn't me. It was just a situation, and it was really organic, and it was so beautiful.
Brannon, we need more coaches like you, like in every program. That is so cool to hear. No, but just to respond to what you were saying, Joe. So, yeah, I did not find that I could just do anything for the same reasons that you're describing. Is like nausea made me really uncomfortable. But the other part of that, right? So you mentioned you're hearing from all of us this like adaptability, which is so true. And that was something I went into my pregnancy very aware of, like, okay, I'm going to have to be adaptable, but I also really wanted to be able to be data driven, because that was, part of my DNA as an athlete. Like I wanted to measure things so that I could use that as a data point. And so I really did like measure quite a bit throughout my pregnancy. And one thing that I found immediately upon getting pregnant, and actually it was my first signal that I was pregnant, is that my resting heart rate like totally jacked up immediately. And so that I think happens for a lot of reasons, but one of them is like your cardiac output increases quite a bit when you're pregnant, right? Which is the amount that your heart is sending, is pumping blood throughout your body. And because you're trying to send blood now to another little human being inside of you, that effort is a lot greater. And from what I've researched as well, your cardiac output can increase by like 30 to 50% during pregnancy. So that is a big need that you are sending to this kid. And so I immediately felt like all the oxygen was sucked out of my body. It was just like, I could not breathe. And because that was something that was so innate to my normal physiology, it was very obvious to me just how much that disappeared immediately. So that was something where I had to really back off. But weightlifting felt awesome pretty much throughout my entire pregnancy. And so that ended up being an area that I leaned into quite a bit because it felt good. It let my heart rate come back down to normal. Like I didn't feel like I was overexerting in that way. I could really take my time with movements where you could think about the setup as your body was changing. And then with rowing in particular, I think when you are really trying to go through that movement in as efficient of a way as possible, rowing is a massive core dominant sport, right? And your core ends up going under a lot of strain throughout a pregnancy. And I think that piece can also vary from woman to woman, right? Like when you actually start to show and when that pressure on your abdomen starts to become like more just stressed. And I was super concerned about the concept of coning and like what was going to happen, which we can talk a little bit about that if you want, Joe, because I think this is a relevant topic. Basically, like the splitting of your abs starts to occur as you get bigger and bigger. And so if you put more pressure on your core through movements that build up that pressure in your abdomen, you are actually often like splitting those abs more than they need to or should. And you can see that movement through this visual that looks like your stomach is raising to a cone in the middle. And I knew that could potentially lead to diastasis recti, which is like a permanent splitting of the abs and is a lot bigger of an issue to recover from postpartum. And I really didn't want to have that happen. And sometimes you can't avoid it, but I did everything that I could to really avoid that. And so once I could feel that I was starting to cone in rowing, I just stopped rowing because I didn't want to have that be something that became a bigger issue. So I guess like what I'm talking about here, right, is just like leaning into the things that you can do and being okay with the things that you can't. And in my case, I felt like being able to measure some of that actually helped to dictate which activities I should like gravitate more towards than others.
Yeah, I think that's a really good point. I think a lot of people like we said earlier, are hoping to maintain some sort of fitness, but they're trying to use their old heart rates and their old splits. And that part has to be let go of a little. Really, all of the literature is recommending this perceived exertion. And more of the studies are suggesting like 12 to 14 on a scale of up to 20. You don't need to get to 20. And you probably won't be able to get to 20, not because you're not stubborn enough, but you're going to feel horrible. And so it's your body telling you, you don't need to do that much. I think people who are able to keep some aerobic fitness throughout pregnancy actually have this amazing ability to rebound. They're able to maintain fitness enough that even though their splits didn't look great throughout the pregnancy and they felt like they weren't doing enough, the second that kid comes out, they're already feeling better. I know that happened to me with all 3 of my pregnancies. I wanted to like skip down the hall after those kids came out, and I had C-sections. And I think that was because I was in pretty good shape. And all of a sudden now I wasn't carrying around all this extra weight.
Take off your weight vest and you take off the mask that you've been breathing through. 100%. Yeah. And my heart rate, my resting heart rate plummeted the day that I delivered. It was so cool. I'm like, okay, great. I'm like totally fit.
Yes, I totally felt like that. My husband was like, you probably should stay in this room in the hospital because these other women are going to hate you. Because I was in such a good mood. I was like, I can breathe. I got this baby. Let's get out of here. He's like, you got to stay here for like 4 days. They won't let you leave. You had a C-section. So there's something just about staying active in any way that you can and listening to your body, which is what we're all saying. And I think one of the things that I see as a doctor just globally is, as an athlete, you're always going to have something happen. You're going to have an injury. You're going to have a setback. We don't really like to think of kids as a setback, but it's an adjustment. And I think before I had kids, I was really nervous about having kids because I just thought, is this thing going to just completely change my life? And I won't be able to exercise and I won't be able to find the time for myself anymore. And that selfish athlete mentality was really nervous. And something magical happens when you actually have a kid where you're like, you know what, it's kind of worth it. If I have to make some adjustments, this is cool. And you find that you're able to adapt, still get in workouts. Not everything is perfect, but you're able to get your old self back. It's just a slightly different version. But just like you have to take a break when you get a stress fracture or you tear your ACL, people bounce back from those things. And so having a pregnancy, you usually get the benefit of being able to do at least something through that pregnancy. And you take off the mask, you take off the extra weight immediately, and you're actually in pretty good shape still.
Like, how about weight gain? I could imagine too, as a lightweight rower, Kate, that was a hard thing. For me, weight gain, I was like something I had stuck in my head as a really scary issue. And especially because this is, I think, is a problem that needs to be changed maybe with some more research, right? Like the recommendations that are given to you by OBs are so like just standardized, right? Like, oh, 20 to 30 pounds is what you should gain, or 25 to 35 pounds, whatever that they say. Everybody is so different. Like, where does that number come from? And so for me, I gained 45 pounds in my pregnancy, right? Like that was, and again, that was another one where I had to be like, okay, this is all right. You don't have to follow the standard. You know your body. It's okay. And the weight came right off after because it's like built into, again, like who I was, to eat well and to try to stay active. And so like that just happened, right? And so I think letting go of that piece as well and being okay with the fact that like, nope, I'm going to gain some weight. I'm not going to restrict that or like try to think about that as a measurement of like the success of the pregnancy. And I can imagine like just for the rowers that you're working with too, Brannon, that's probably something that you saw.
Absolutely. And that doesn't even include Black women. I mean, she gained a ton of weight and she was still able to it's just that number is absolutely completely arbitrary. And I think what's interesting too is it's so easy to focus on the weight and there's no way you can predict how much weight you're going to gain. But I mean, one of my moms, she didn't pop until her first kid, she didn't pop until very, very, very late. And then her second kid, she popped immediately. So I mean, it's just, you never know. But the weight gain, I mean, just the stress of watching your weight go up, that in and of itself is debilitating. So, as a coach, I spend more time just letting them know they are, like Kate said, like, you're going to be able to get it back. It's going to come off. You know what I mean? Just adjust your expectations. Again, you got to adjust your expectations. It's an uncontrollable, you know what I mean? So if you continue to weigh yourself and stress out about it, you're going to break down somewhere else. you know, and I think it's just a really tough
I think there's a
time.
lot of mixed messages too. I mean, when you go to the OB office, you have to get a weight and you do a urine sample because they're making sure that you're not getting gestational diabetes or some other, or preeclampsia. Like, we don't want to say you can gain a ton of weight, but like, we're talking about a bunch of athletes who aren't probably going to do that anyway. You know, 45 pounds, fine. It wasn't 90, you know? So I think we're nervous about it, but we need to kind of leave it to the doctors to be measuring these things and having concrete data to give to the doctors, and then the doctors can act on it, not for us to try to interpret it ourselves as moms. I think every single pregnant mom, probably their first pregnancy, more often than not, is the one where things are a little easier and they don't pop as quickly. And the second one, they're immediately looking pregnant and they're like, whoa, what just happened? You know, because your body's already been through that. But, and of course, with husbands or partners, you're always like comparing your weight. You know, I definitely didn't want to start weighing more than my husband. That was a big scare, but thank God he's 6'4", so that was going to be really hard to do. So we just play these little games in our heads and compare ourselves to each other. But I think do the weight at the doctor's office so the doctor can act on it. You don't need to obsess about it. As long as you're exercising, you're already doing the best thing that you can. So eat well and exercise, and the rest is just going to happen, and don't judge it.
One area I'd like to kind of come back to that got touched on is rate of perceived exertion, and how that's a good strategy when we're doing either rowing or strength and conditioning work to kind of calibrate your workout. And I think this really kind of fits in nicely with this theme that we've come back to of being adaptable. So there's kind of different versions of the Borg scale. You have 1 to 20 or 1 to 10. But what I'm curious about is maybe all of you could kind of speak to how that scale got adjusted. So this is what you normally kind of try to gear your workouts to. And then as you headed into pregnancy, you sort of had to kind of readjust or recalibrate that scale internally to make sure that, you know, it was something that you could do for the activities and was appropriate.
Yeah, so Joe, I guess I can jump in there because since I touched on that too. So I guess the way that I thought about this was really, you know, when you're an athlete and you're a part of a team, you might not want to go to that deep, dark place that's a 10 out of a 10 sometimes, but you have to anyway, right? Because you've got teammates or you have a goal and you have to train that hard and you have to go there. So for me, it was much more about, hey, if I don't want to do this today because my body's telling me this isn't the day, then just don't do it. Right. So like allowing yourself that opt out, where usually I would never give myself that. So on a day where I was super fatigued or tired, I used that as the signal that like, hey, if you're going to do some kind of activity, you need to keep it light. Right. Like, so either do it like a short, little, easy, steady state piece or go on a walk or whatever. There were actually days where I felt so good and my body was like just going that I did probably hit a higher rate of perceived exertion out of that scale of 10. So like maybe approaching 7 or 8, right? And so it wasn't necessarily that I limited myself on that scale like with a finite level. It was more on a day-to-day basis, understanding how to push and pull and when that was appropriate. And there was actually a time at the end of my pregnancy where my OB was like, okay, it's time to get this kid out. You got to go do some hard workouts. Okay. And I was like, great. So I was like going for it on the bike and like doing kettlebell swings and had all these videos of myself trying to do this. I'm like, why is this kid not coming? And I felt good. And my doctor was actually advising I did that. And so it was a safe approach. So I guess the way that I'm describing that is much more on just a day-to-day basis, like giving yourself that forgiveness. And your sleep is so disrupted during pregnancy too, right? That has a huge impact on your energy level, and just understanding that it doesn't make sense for you to push yourself beyond what you might have on any given day.
Yeah, it's funny. I think by the end, the OBs are like, oh my gosh, just do whatever it's going to take. I remember being at the boathouse and just scaring people on, you know, on my due date on the bike, just like, what, you shouldn't be there. I'm like, yes, I should. My OB says I should, and we need to get this kid out. I'm doing it. And so I was doing the exact same thing. It didn't work though, but it sounds good. It made me feel awesome. And so I felt like I was doing something proactive to get her out.
So what are some kind of key things that, each of you feel are important for a rowing coach to kind of know the first time they're working with someone that might be pregnant? Um, just to keep in the back of their mind. Like I know, Brannon, you talked a lot about making sure you have a conversation with them one-on-one. You have sort of an individualized plan that is going to be supportive, but takes in, their needs and interests in terms of maintaining activity and getting in some type of movement, right? But what are other things that we kind of need to be mindful of? And I'll put my hand up as the only guy on this Zoom call, is that we may just not know, right? Like we're ignorant to the fact of what's taking place because we're not going through all these morphological changes. We don't know how it feels day to day when you're nauseous or, your energy levels are low. So what are some of those things that, we need to be from a coaching standpoint, much more aware of, when we're working with a pregnant athlete? Yes.
So Joe, I would say one of the things that I think is definitely not talked about, especially in the rowing world, is just the like structural changes that are going to go on in a woman's body. Some of these are permanent structural changes, like to your hips, your back, your feet. But while you are actually pregnant, it's really important, if rowing is the only thing that you're doing, I think as a coach, to advise your athletes to add in other exercises that are going to help them through their delivery based on like core work and pelvic floor work. All right. Like that ended up being something I focused on a ton, and it made a huge difference. I think both in my rebound and my delivery. Right. So like encouraging your athletes to do diaphragmatic breathing exercises, to do exercises that actually help to strengthen that pelvic floor. Right. And when we think about accessory work sometimes that we give our rowers to do, and whether that's weight training or core work, that should shift a little bit and be even more focused and targeted for a pregnant woman. And I think that will end up actually helping their rowing journey while they're pregnant as well, because it can allow you to be able to like contract muscles properly, to engage your core in that way that you need to off the catch, and then set you up just to be able to really protect those areas that are under a lot of strain as you continue to grow and progress throughout the pregnancy.
I think that's such a good point. Number one, I think for a coach to feel comfortable and know that now the literature says that there were a whole bunch of myths that we don't need to be so scared about. There's not an increase of miscarriage. Exercise is not going to induce poor fetal growth unless you're doing super duper high intensity at the very end of your pregnancy, and maybe you'll have a slightly smaller baby, but there don't look to be any negative outcomes with exercise. There's not an increased risk of musculoskeletal injury if you're doing it correctly. So all these things that women used to be told 50 years ago are just not true. So, we're talking about pushing ourselves too much, but there's another whole set of the population of athletes who are nervous to do anything because they've heard these things, or they have maybe a kind of antiquated OBGYN telling them that. So we don't need to be concerned about more abnormalities in the kid by staying healthy. Second, I think what Sara said is so important. We talk about core work, and it's such a general term, but I had to discover what my lower abs were. I had to discover what my pelvic floor was and how to even access those muscles, because unless you have someone really teach you how to do those exercises, you might just think, oh, that's sit-ups. And really it's a lot more stuff. And whether you've had a C-section or a vaginal delivery, the whole process of being pregnant causes the pelvic floor to kind of get stretched out and not get engaged as well. And coming out of pregnancy, that's going to affect your ability to row. It's going to affect your ability to run. So if you can keep those muscles really strong and understand how to strengthen them, that's going to be hugely beneficial as an athlete regardless.
Yeah, and I would say making sure we know that your athletes, they're not sick. You know what I mean? I think for my guy coaches, my assistant coaches, I have to really reframe sort of their perception and reframe how they're thinking about, once, we find out an athlete's pregnant, the guys kind of get a little squeamish and don't really want to coach them. And you know what I mean? Like, it's just, I spend more time probably educating my guy coaches about, like, they're not sick, it's just, they're in a different part of their lives. And I think of that as that we start to reframe that and we get more information and there is more studies done and we do start to kind of wrap our brains around this, it'll definitely help us move forward in a much better, more healthy, cohesive sort of way.
So this is great. This is very helpful. So I guess one other kind of direction to take the conversation is we kind of talked a lot, I think, about what we can do, strategies, things to consider both on the coaching front and as a pregnant rower. But are there things that we need to be aware of, like as we get into the second or third trimester, where, like Sara, you had mentioned there was kind of like a cutoff point where you weren't rowing anymore just because of coning, right? So are there other considerations that we might need to think about or be aware of, that play a factor? So another one, Brannon, you talked about being there for your athlete to help them physically get in and out of the rowing shell, right? And that might be a point where they can do it physically, but maybe that individual is not comfortable doing it anymore. Maybe they don't want to do it anymore. So I guess my question is what are other things that we need to, from a coaching standpoint, think about as we get into the later term of the pregnancy?
So Joe, another one is joint laxity, right?
Yeah.
That's actually a really important thing, I think, for coaches to be aware of, right? Because, and this will impact different women different ways. Like I typically am a really like immobile athlete, where I know a lot of women are naturally more hypermobile. But this is a case that's going to happen, as your hormone levels change, especially in the third trimester, like you start to experience more joint laxity. And so I think a coach should technically be aware of watching their athletes like hit that end range of motion and understanding like it might be helpful to pull them back from that end range so that they're being safe with their joints, because like I could feel this for sure. Like my hips were moving around a lot more. My knees weren't quite as stable. So I had to be really slow and purposeful about my movement as that started to happen, to make sure that I like wasn't going to a place where I could end up hurting myself or a joint. But because I was actually more of an immobile athlete, right? And like the first thing for me to go ever, if I don't stay in touch with rowing, is like I can't comfortably get into that catch position through my hips. I could actually get there better than I could previously. So like that to me, I was like, wow, this feels great. I can get to end range of motion. But I think just recognizing, right, that that's something you should be watching for and coaching, or like shoulder position, I think with joint laxity would be a good one to keep an eye on, making sure that you're not letting those athletes get like too far end range or out of the socket, because you're just going to end up putting like more strain on those joints than they typically would without those hormones in place.
Yeah, I think the technique really needs to be paid attention to. I can't even imagine rowing in an 8th month of pregnancy myself, because I was so big that technique of my rowing would have looked so weird. My hips would have been really out of whack. And so you're going to get other strains on your joints that aren't intended to get there. I'm the opposite of Sara. I'm hyperlax to begin with. And so my husband and I'd be walking down the street and I would just bite it. Like my ankle would just twist and I'd be down. He's like, what just happened to you? So I was so lax that I had to be super careful, even in terms of running by the end, because my ankles were really unstable. So we have to take into consideration the laxity, but looking at the rowing technique, if people are just doing really weird stuff to try to get from one end of the stroke to the other, there's no benefit in that. That's going to cause injury. That can put pressure on the disc, that can put pressure on the joints. It's not necessarily worth it. So switch over to something else, switch over to the bike, switch over to the lifting, doing the other things so that you're complementing rowing by doing other exercises.
I think that's a great point.
Coach, the best way, oh, sorry, Sara, go ahead. Do you want to?
Nope, go ahead, Brannon.
As a coach, the best way I think to call it is just the rowing technique is very specific. So once your body's not able to maintain the proper technique, as a coach, that's the best time to call it. Then it takes the emotion out of it, and it takes you're saying I can't do it. Like you got to set the technique as the barometer, and you can row as long as you can maintain a technique. Then it's not, I'm telling you can't do something.
Yep, I think that's a really good standard, Brannon. And that was actually a standard I used for any movement, right? That I was doing. So if this gets uncomfortable to the point where I can tell it's like a wrong kind of uncomfortable, or I have to really alter my technique, then it's time to stop that. And I think that like what you're both touching on is a good reminder that as rowers, you can be really fit and actually make improvements to your rowing without doing the rowing stroke, right? Like, and that's a lesson that I learned when I got injured at certain periods. And I've seen countless other athletes experience this too. Once you can switch their mindset, you don't need to just row to be good at rowing, right? And you can actually improve your rowing capacity and ability by cross training and adding in maybe things like weight training that will improve your position and your overall strength and your ability to get to, to extend your time to exertion without actually doing the rowing stroke. Have to do that for your third trimester, let's say. Focus on these other things that maybe you wouldn't necessarily be able to if you were only rowing, and watch what it does for your rowing when you do then go back to it, right? Like, I think many athletes would be very surprised by the positive impact that can have.
Yeah, I mean, as much as Brandon said, we're not injured. Absolutely. When you're pregnant, you're not injured. But applying what I see with injured athletes, I always tell my athletes who are crying in my office and super upset that they can't do their favorite sport, there's always something you can do. There's something there, whether it's doing more upper body, whether it's doing core, like whatever's injured, let's focus on a different part now. And that is going to be used to complement your exercise and your ability to do your favorite sport when you're through this phase. So we really need to emphasize that all the time, and it makes for better rowers.
I think what a lot of these things that I'm hearing too, Joe, from everybody's experience is like, it's really great for coaches just to have some of these items on their list of like things to be aware of, and not necessarily having a playbook of like, this is what I can expect my pregnant athletes to go through and the exact timing, right? It's more like, okay, I should be aware of like pelvic floor strength and technique issues and joint laxity and the importance of community and the importance of empowering my athletes to continue to stay active. And that's going to look different case to case. But as long as I kind of have these things in mind that I want to, keep an eye on, and maybe that's part of the reason that the research doesn't like show it exactly, right, is because it is so different from athlete to athlete at this point. But I think that's what I would hope, coaches could walk away from even this conversation with, is recognizing that there are some important topics to like have front of mind, and that you then have to also like help your mom athletes then navigate that in whatever their journey is going to look like.
So I have a fun question I think to ask each of you. So what's like one thing that you learned, and it might be different for everybody, is like, what's one thing you learned from the pregnancy that like completely shifted your perspective afterwards, and you think is like beneficial, for other women to know, or coaches to know?
I think for me, it was that even though I had different exercise tolerance and allowances through my 3 pregnancies, that I was able to bounce back from each one of them. So I thought with my second one, when I wasn't able to do much at all, that it was going to be a much harder road to get back into shape and to feel good. And even though I gained more weight with that pregnancy, I wasn't able to exercise as much with that pregnancy. I was back to myself really quickly. And so much of that speaks to just the mindset that we have as athletes, that we do what we need to do and it comes back. And so that was a surprise to me, just as an individual.
I think mine probably would just be about the why for training, right? And this sounds like very kind of typical of maybe somebody with my background in sports, to be like, okay, my why previously was to perform and to hit these numbers and to, like go after these specific goals. And I mean, that's been a process that I have worked on and approached since retirement before pregnancy too, is just like changing that mindset of the why you're training. But pregnancy, I think, was just another transition that helped me to see there's even another purpose to fitness and to wanting to train, right? Like now it is very much so my self-care. And am I still aware of the performance implications? Do I still want to improve? 100%. Yes. But it's much more about like, I need to carve out the time in my day to do this, both when I was pregnant and now that I'm postpartum, right? Because I know that it's really positive for me taking care of myself. And so I think that that's just kind of a nice mindset for anybody who's in that athlete mentality, to realize like there can be another purpose besides your splits in going and spending that time in the boat or spending that time in the gym.
Yeah, I think for me is as a coach, I think I really learned how to really think on my feet and just engineer solutions in real time. I mean, we've had everything from somebody show up and not be able to row, like, and I'm sending you for a walk because it's not feasible. You can't do it, and you can walk, along the river and be in the environment. But you know what I mean. I think it's just really having clear expectations and understanding, that you want to build an environment where your athlete can thrive, where they can stay healthy and come back. So, I think you've just got to be very, very clear about your expectations and very, very clear about, protecting both the mom and the kid and making sure that you don't become a liability, right? And they don't become a liability to themselves. So I think it's just being really, really clear. But I think as long as you keep that focus on, I want to create an environment for this athlete to thrive, be able to deliver, and then come back. And as long as you're doing whatever you can to do that, then you're going to be fine.
That's fantastic. I want to be respectful of everybody's time and everything. So we're coming up towards the end of scheduled allotted time. Is there anything that we didn't touch upon, or something that you thought of that you want to share and put out there? Yeah. Is there anything else?
I think just from a research hat, as a researcher, I'm excited to get more women involved in this and caring about this issue so that we can get more data and we can advise people better. There's just such a dearth of literature, particularly in terms of intensity and also with elite level athletes, that we need to be doing more on. So I'm excited to have more people involved in those studies. It's sort of a call to action to get more people looking at this and getting more rowers and other elite athletes to participate in that work as well.
I might just say, I think we kind of touched on this a little bit already, but right, this is a finite period of your time, of your life. And while you don't want to like lose the things that are important to you while you're going through a pregnancy, I think it's something that like, if you wish away those moments because you can't wait to get back to like being not pregnant so you can do things you could before, you're going to miss out on these really amazing like moments that you can enjoy. And experience like your body in a way that you won't ever experience it outside of pregnancy, right? So it gave me a really huge appreciation for what our bodies can do, right? Like, okay, I know my body can like go perform at the Olympics, and that is a cool, amazing thing, but I'm prouder of the way that it was able to go through pregnancy and deliver my son than I am even of my Olympic performance, right? Because it just like blew my mind what I was able to do. And so I think that's just like such an incredible experience and opportunity if you are fortunate enough as a woman to be able to go through that or choose to go through that, right? Like just like lean into that, right? And try to be present in all of it, even the parts that suck and are uncomfortable, right? Because it is a short period. It's going to be done eventually. And if you don't have multiple pregnancies, right, then like, or if you only have a few of them, right, you don't have tons of years to experience that. So I would just suggest like really trying to be present in that moment and enjoying all of the things that your body goes through while it's happening.
Brandon, did you have anything else?
I feel weird because I'm not pregnant. I haven't been pregnant, so no.
That's okay. I mean, if you have a perspective from coaching.
No, I think I said everything.
Okay.
I mean, I think the physical, I think one funny thing I will say is the physicality changes are definitely noticeable. And I think I wish there was more transparency around some of the changes. And I think women should talk to more women. And I think that women, whenever they're in an environment where they feel heard and seen, there's this really dope sort of synergy that starts to come where, you know, like they're in the quad farting and they're not even apologizing about it because like I'm pregnant, I don't even care. I'm gonna fart this whole practice. And like there's this really sort of lovely kind of camaraderie. And I'm really happy I'm on a launch, like I am, but you know, I think it's nice to witness. It really is. And I think that, you know, I think more women should talk to more women. I think, you know, I think white women should be talking to Black women, brown women. Like there's just this really, the more transparency we have and the more honesty we have, we're going to realize things that need to change and we're going to be able to change it. You know what I mean? So, I mean, there's nothing funnier than a 5 a.m. practice with a pregnant woman in a quad and she gives 0 Fs. Like she doesn't even care. And it's so liberating. And it really makes my coaching experience, has informed my coaching experience and has made me a better coach. Absolutely.
I think that's such a good note to end this podcast on, is just women who are pregnant farting at each other. I mean, I think that's the take home message. I think that's what I've learned today.
Oh my God, that's amazing.
This is fantastic. We're gonna just let that be the bow on this podcast. But I do want to say thank you so much to each of you for carving some time out on your Saturday to participate in this discussion. And I hope this is the start of many more conversations. So thank you all so much.
Thanks. It was a lot of fun.
Great talking to you guys.